ways in which you earn a patient's trust is by one, taking yourself out of the picture and not to take things personally, but also at the same time understand that possibly the actions that you take, the prescriptions that you write, that could be part of the problem. And I say, and then whenever I'm talking to my friends who are white or talking to doctors who are white, I tell an example. I did my residency, which is training after medical school at Morehouse School of Medicine in Atlanta, Georgia. I took care of a patient who was in his mid 60s. He jumped over a fence, he broke his ribs. I took care of him in the ED. We did CT scans on him and noted that he had multiple rib fractures. I sent him home, right? Because he was complaining of pain, but he wasn't in that much pain. So I thought. Came back 2 days later, he was in respiratory failure, but we ended up giving him pain medications, and he was okay. But one of my attendings, who's in his 60s, 70s, took me to task in front of that patient and said that, you know what, you're here as a black physician at Morehouse School of Medicine, and you just practice a racial disparity or health disparity. I'm like, what are you talking about? He said that you didn't take his pain seriously. You possibly may have lacked the knowledge possible to treat this patient. And he just went through X, Y, and Z and read me the riot act. And to this day, that's what, over 15 years ago, I've never forgotten that. So even me as a black physician, born in Queens, New York, raised in Newark, New Jersey, went to a HBCU for my residency, can practice healthcare disparity. So if I can practice it, damn sure someone who's not from my community can do it. And it's not an accusatory thing of you're going to do this. It's just there's these implicit biases that occur within medicine, the training that's in medicine that helps us perpetuate these things. So for someone who's really interested in this, the key thing is to not put yourself, like, make sure that you depersonalize yourself and really think about what it's like to be in that person's shoes, what it's like to come from a generation of people who hear, don't you go to the doctor, like they're going to experiment on you. Like, why are they saying this? Like, right, like you have to understand and put yourself in that situation. When I work in rural neighborhoods or I work in suburban neighborhoods, when I look at a patient who happens to be black or non-white or who happens to be white, like I look at them as, if I let this patient die, like their entire family, like I don't know if this is a brother, a sister, a mother, right? I humanize the patient because they are, right, they're an extension of their family. And I think a lot of times, I can't speak for a lot of people, but I think that sense is sometimes lacking. People don't look at people as, this is a father, this is a mother, this is a daughter, this is a brother, this is someone who is the primary breadwinner. So therefore, in that sense, I have to do X, Y, and Z to make sure that this person gets home and continues to be, a part of society. Right? That's really important. The other thing too is asking, like, what am I doing that's part of the problem? How can I be a part of the solution? And ultimately, the best way, I think, is, not going to Black Lives Matter meetings or wearing a t-shirt that has a fist or wearing, Black lives are important here, like none of that stuff. It's educating yourself, understanding history, understanding redlining, understanding slavery, understanding how all of these different literal social determinants have affected the healthcare of African Americans, of people from Latinx communities, of Native Americans, how literal rules, laws, all of these different things take an effect on them. So that's what I would say to someone who is not black, not of a minority background, but is interested in not being a part of the problem.